Good afternoon and welcome to today's webinar. Today is part 4 of the series that we are producing called Reducing Your Risk of Heart Disease. Today's topic is preventative exercise and physical activity. The webinar series is sponsored by Mended Hearts and the American Society for Preventive Cardiology with an educational grant from Amgen. Today, we have presentations from Dr. Lopez, who is the Chief Medical Officer of Real Life Health, a personalized cardiovascular metabolic prevention program, CEO of Lopez International Medicine Associates, a private practice in Jacksonville, Florida for over 20 years that focuses on the treatment of lipids, cardiovascular disease, and diabetes. Dr. Lopez is also faculty at Lake Erie College of Osteopathic Medicine at the Bradenton, Florida campus. We also have Tiffany Hackett-Stuart, who is a registered nurse. Tiffany was born with the coarctation of the aorta and a bicuspid aortic valve. She became active in advocating for patients after becoming a nurse in 2006. Tiffany works as a nurse case manager at the Phoenix Children's Hospital in Phoenix, Arizona, and is passionate about her ability to advocate for her patients. My name is Andrea Baer. I am the Director of Patient Advocacy and Program Management for Mended Hearts and Mended Little Hearts, and I am also a mom to a 10-year-old son with congenital heart disease. I will be the moderator for today. Just to let you all know, everyone is in listen-only mode, except for the presenters. So if you have a question, please feel free to enter it into the chat box that is on the right-hand side of your screen or raise your hand. At the end of both presentations, we will do a question and answer time, and we would love to be able to share the questions that you have about that. To get started, Mended Hearts is the largest peer-to-peer support network in the world. And Mended Hearts' mission is to inspire hope and improve the quality of life of heart patients and their families through ongoing peer-to-peer support, education, and advocacy. We have 285 chapters across the country, serving over 460 hospitals. The American Society for Preventive Cardiology's mission is to promote the prevention of cardiovascular disease, advocate for the preservation of cardiovascular health, and disseminate high-quality evidence-based information through the education of healthcare clinicians and their patients. With that, I am going to turn it over to Dr. Lopez, who is going to give us some information from the medical professional's point of view. Dr. Lopez?
Thank you, everyone. My name is Al Lopez. I wanted to thank ASPC and Mended Hearts for this opportunity. So today I'll be talking about exercise as a primary and secondary prevention for cardiovascular disease. Next slide, Ian. So sedentary lifestyle is one of the major risk factors for cardiovascular disease.
I think we've lost you, Dr. Lopez. Are you there?
Yep, can you hear me?
Yes, now we can. Thank you.
All right, let me start over again. I apologize. So we know sedentary lifestyle is one of the major risk factors for cardiovascular disease, and over 25% of the general population's attributable risk for MI or heart disease is due to inactivity. We also know that sedentary lifestyle is important and risk factor for chronic disease, and that's all chronic diseases. And we know that cardiovascular disease is pandemic worldwide at this time. The World Health Organization estimates about 75% of the premature cardiovascular disease is preventable. And it's improved as we improve the risk factors, we can prevent those diseases. And those modifiable risk factors include exercise, diet, and the recommendation is 7 to 10 servings of fruits and vegetables a day, high fiber, low sugar, low salt, smoking cessation, weight reduction to ideal body weight of 18.5 to 24.5 BMI, alcohol limitation of 1 to 2 drinks for men a day and 1 for women, lipid or cholesterol lowering therapy, antiplatelet therapy or aspirin, glucose control and normalization in the person that has glucose intolerance or high sugars or diabetes, with hopefully a fasting below 95, and Dr. DeFranza would argue below 88, blood pressure control, and controlling inflammation, systemic inflammation. So regular exercise and physical activity are important in reversing and reducing symptoms, events, or death in a number of chronic illnesses. Diabetes, elevated blood sugars, obesity, lipid or cholesterol disorders, high blood pressure, aging, cancer, osteoporosis, depression, all improve with regular exercise. And cardiovascular disease, including heart attack, stroke, arrhythmias or rhythm disturbances, peripheral arterial disease, in multiple studies, in multiple disciplines, consistently document lower incidence of coronary events on those who are physically active and fit. We went through the last slide. So the question is this new ideas or old ideas? If we go back to Shashuta in 6th century BC, he was an Indian physician in India. He was credited for writing the first prescription for exercise. In 5th century BC, a Greek teacher named Herodonicus, a teacher of Hippocrates, described exercise for recovery of illnesses. And actually, Plato criticized Herodonicus on how his training practices were unnecessarily prolonging his lifespan and those of others. So a quick exercise glossary, and mainly because as my daughter heard this, she said, you know, can you explain some of these things beforehand? So here we are. Physical activity is a body movement produced by skeletal muscles and results of energy expenditure beyond resting level. Exercise is different in that it's planned, structured, repetitive, and purposeful, and gives you a sense that improvement and maintenance of physical fitness is the objective. Physical fitness includes multiple disciplines, including, respiratory fitness, cardiorespiratory fitness, physical strength, body composition, and flexibility. Dose is the energy of expended physical activity. Intensity is how hard you do or the rate of energy expenditure. And then absolute intensity, this is important, the next two is done in MET. It's usually the rate of energy expenditure during exercise. And a MET is a calculated rate that we can talk about later as 3.5 mLs of oxygen per kilogram. And that energy is expended beyond sitting, that's sitting quietly. So if you expend 8 METs in exercise, you're using 8 times your resting rate. And then relative intensity is the percent of aerobic power used during exercise expressed as. There's a background. Okay, primary prevention is the prevention of disease without known disease, and secondary prevention is the prevention of recurrent disease. If you have disease, you want secondary prevention to not allow disease to recur again. CVD is cardiovascular disease, CAD is coronary artery disease, PVD is peripheral vascular disease, VO2 max is the maximum rate of oxygen expenditure during exercise. And then relative expenditure is a percentage of aerobic power during exercise. And that's usually expressed as a maximum heart rate or a maximum oxygen consumption. So now we've got through the doldrums, let's talk about exercise. So exercise has many pathological pathways that it helps us. One, we know that it increases baroreflex sensitivity. We know that it also increases endothelium, which is the inner lining of the arteries function. It actually decreases inflammation markedly in doing this. And it does this by increased nitric oxide production. It decreases insulin resistance, decreases obesity, decreases blood pressure, increases adrenal function. So kidneys actually optimize, which also helps in blood pressure and insulin resistance. It increases your blood body mass and your blood plasma volume. And it decreases heart rate. So you optimize your engine, it works more efficiently, increases heart mass to a certain size, and then improves heart function. And then it decreases sympathetic tone, which usually tightens the artery, and increases vagal tone. Next slide. So the main benefit of exercise is by increasing this nitric oxide or enos, we increase anti-inflammatory myokines. And these are small proteins produced by muscle cells. That decreases stress in the arterial wall. It also allows, on the right, vascular remodeling, which means that the vasculature actually improves, and it improves its elasticity. It enlarges the conduit of those arteries, so you get not a small artery wall, you have a more dilated artery wall that's stronger. Increase autonomic balance and decreases beta adrenergic receptor sensitivity, which decreases heart rate. And then you increase this preconditioning, which is very cool, which means that even if you have heart disease, if you start the very low workload, you start getting what's called preconditioning, which allows you, by doing small workload, to actually benefit and dilate the arteries, and you can perform more function. This is done by increased nitric oxide and decreasing the risk of coronary disease, and increases calcium in the mitochondria. I think this kind of portends the whole issue of exercise reduces the risk of heart disease by 42% of people. And you know that even with mild exercise, you can get a 20% reduction just by walking. With people that are very active, and we'll talk about this later in the talk, can have up to a 42% reduction in events in heart disease. Next slide. This slide's really interesting, and it seems very complex, but it's not. Let's start with moderate and the blue dots. Even if you do only 20 minutes of daily physical activity, 15 minutes, you get a 14% reduction in death from cardiovascular disease. Actually, it's all-cause death. It's not just cardiovascular disease. That includes from diabetes, that includes from cancer, that's overall death. If you do about 35 minutes, you get a 20% reduction. If you go all the way up to about 90 minutes daily, you get a 35 to 40% reduction in cardiovascular all mortality. Now that changes if you move to a more intense exercise regimen, and you can get a much higher benefit of about 45% reduction at about 50 minutes of exercise daily. Now that isn't the total recommendation. We'll go to exact recommendations as we go far in the talk. But now, even just walking 15 minutes a day reduces your risk of all-cause death by 15%. That's impressive. We don't have to run marathons. Next slide. This is a fascinating study, and I put in a couple of studies so you see that I'm just not pulling the rabbit out of my hat. This was done on almost 6,000 asymptomatic women. And until the 2000s, we were mainly looking at white men. We didn't really look at women. We didn't look at much other populaces. And we didn't certainly look at people with severe disease. But the average age in this population was 52. And what we found that the highest risk patients were those who were smokers and diabetics and those who had no exercise. Those that exercise was the strongest independent risk factor of all-cause death in this study, which was very impressive. If you look at the top box, and it's small, and I apologize, FRS, Framingham Risk Score, and it's a scoring that most medical providers will use to assess your risk. And I personally find that this is an undervalued risk because it doesn't take in women very well. But if you look at the 10-year all-cause or 10-year coronary artery disease risk, in both of these, if you see that in the time and years that the higher risk you have, the worse outcome you have long-term. Not a surprise. But independent of that, they looked at, go back a slide, Andrea, and the analysis of time and years. If you exercise just under 8 METs, you had a better survivability. You actually had a prolonged life versus those that did not exercise. And for each MET that you exercise, you had a 12% reduction in death. That's pretty impressive. So if you exercise at close to 6 METs, you have almost a 70% reduction in cardiovascular disease. That's impressive. The other things confirm the protective role of higher exercise, even in the presence of established coronary risk factors, as in the above slide. And then it talks about METs. Those, if you used 5 to 8 METs, you double the risk of death compared to those that did over 8 METs. And if you only did under 5 METs, your death was triple compared to high exercisers. So the bottom line in this slide is better treadmill time, greater exercise capacity, less cardiovascular death, less overall death, less cardiovascular disease, less symptoms. So blue is your endpoint, right? So, you know, a lot of studies were done until recently and combined on using strength training or resistance training in aerobic exercises. But this was done out of 3 different studies. And resistance training, along with aerobic exercise, had a better end effect on cholesterol profiles, bottom line, and have healthy individuals that just did aerobic activity alone. That was the Attica study. But even if we know if you did resistance training 1 to 3 times a week for less than 60 minutes weekly, independent of doing aerobic activity every single day, this is combined resistance weight training with aerobic exercise, you still reduce your total risk of cardiovascular disease. And cardiovascular disease, if you did it over 4 times a week, didn't have any better benefit. And the exercises they looked at was not pure strength training like you see in linemen and football. These were people that had that did kind of 10 repetitions, 8 to 10 repetitions, 3 sets using 7 big muscle groups. And this bottom study was done in people with known peripheral arterial disease or had disease leg and had severe disease that they couldn't walk, so they tried strength training, and even they had improvement. Next slide. This is a quick slide that shows that if it's kind of, look at the green, that's the benefit. If you look at the very center where it says low,
I think we're losing you again, Dr. Lopez.
you tend to get heavier, fatter. Adipokine dysregulation, you get fatter easier, increased cardiovascular disease, there's increased endothelial dysfunction or arterial wall dysfunction, and increased insulin resistance or diabetes. But if you exercise, you get reduction of cardiovascular disease and obesity, and there's an improvement of all of those. And the dotted line is the reduction. The Inner Heart study is a very highly quoted article that I use a lot, and this was done in 52 countries, 15,000 patients, 14,000 controls, so about 30,000 patients total. And they looked at all cause of cardiovascular death across the world. And the most common things were smoking, hypertension, diabetes, waist to hip ratio, dietary patterns, how you eat, physical activity, how much alcohol you consume or don't consume.
We are having a lot of technical difficulties today, aren't we?
Certainly are. Are we back on?
We are back on now. Are you there?
All right.
All right.
Yep. So they didn't even look at LDL cholesterol. They looked at ApoB lipids, which is a bunch of factors of lipids. It's LDL, VLDL, ILDL, triglycerides. And they looked at psychosocial factors, depression and high anxiety, increased risk of death. Next slide. And what's fascinating, if you look at this, and just tap it again, Andrea, you'll look at fruits and vets. On the left is better improvements. These showed better odds of not having cardiovascular disease. On the right, not so much odds. And if you look, exercise, fruits and vegetables, and alcohol had the most improvement or caused the most problems with heart disease. If you didn't exercise, you didn't eat all of those fruits and vegetables, and you consumed lots of alcohol. Next slide. And there we go. I put a few slides in here, and these are the top in the last 5-6 years studies that have showed how exercise improves. And we found that running at slower speeds, defined less than 6 miles in less than 50 minutes, even twice a week, was associated with significant benefit. There was a U-shaped curve. The more you exercise, the better you had cardiovascular outcomes with higher intensity. But if you did too much intensity exercise, like back-to-back marathons, those people actually didn't do as well. And we see this in high elite athletes that are extreme athletes. They don't live any longer than the average person. They actually do worse. That the person that does moderate to vigorous exercise, physical exercise twice a week, and moderate exercise the other days actually live longer than those extreme athletes. Non-smoking was very important, and there was a 73% reduction attributable to just healthy lifestyle, which is exercise and eating. Next slide. There was a suggestion in the Atkinson study in Sweden that if you didn't exercise, you had 80% higher risk of having heart disease. So it was very preventable in 80% of the cases. And then women, again, in the Armstrong study, this is different than Dr. Galanti's study, which I showed you earlier. If they did strenuous exercise, they actually did worse if they did it more than 3 times a week. But if they did it twice a week, they did very well with moderate exercise in between. And then duration, but not intensity. And the last study showed that it showed better improvement. So high intensity every day is not the best for you. Next slide. We talked about the USEF study in InterHeart, and I talked about that in 2 slides prior. And then the Galanti study was a women's-based study on exercise. Next slide. The only reason I show this is that even with 1 episode, again, preconditioning, once you even walk once a week, you precondition your heart, and those people do better. And again, I showed you earlier that if you work 15 minutes every day, you have a 14% reduction of all-cause death and cardiovascular death. When you add to that and you do it several days, your preconditioning gets better. So let me give you the human example. I don't exercise for 2 years. I get on the treadmill and I can barely do level 1. I can't grade it up and I can't last 10 minutes and I'm cleaning the floor with my tongue dragging. I'm just sucking wind. But if I do it for a week and I do it a couple of times, my exercise, my preconditioning gets much better. As you improve that to weeks, now you start getting functional adaptation. I get better and better at it, and your heart accommodates to that. Your body accommodates. You get dilatation of and you start getting structural adaptation, that your body actually adapts to it better, and you get that dilatation of the arterial wall, and your heart becomes stronger in and of itself. Next slide. So what do we recommend? So to prevent the first heart attack, we recommend 30 minutes of moderate activity 5 days a week, or vigorous exercise for 20 minutes 3 times a week. The preference is a combination of moderate 5 days, vigorous 2 days a week. And when I mean moderate, the minimum is about 10 to 15,000 steps a day. And that's a good quick step. It doesn't have to be a fast walking step, but it is not a leisurely step that you're whistling. The above is in combination to daily activity, the things you do every day around the house: cooking, cleaning, walking, watering plants. And you can even do it as 10-minute bouts throughout the day. You don't have to do all those 30 minutes at once. And then twice a week, we do recommend major muscle groups to be used. So doing some muscular strength exercise, maybe a bench press, maybe arm curls, maybe leg press, maybe body squat. Next slide. Exceeding over the minimum amount of that exercise I discussed showed no benefit in multiple studies. And not my. The European Society of Cardiology recommends about 300 minutes a week, very different than we recommend here in the States, or 150 minutes weekly of vigorous exercise. And then doses above 100 minutes a day of moderate activity doesn't really associate to be better. It actually shows worsening of cardiovascular function and death, and may not do well long term. So we start with low intensity activity, sedentary individuals, or individuals with multiple risk factors, and then work your way up. And it's good to go to have an exercise prescription with your doctor or exercise physiologist or nurse. And then reducing excessive sitting to less than 3 hours a day is important, and excessive television watching of less than 3 hours a day. Our other recommendation for weight loss and just cardiovascular fitness, if you have a sedentary job, is every 30 to 60 minutes, move for 3. Just get up and move around. Because there is an inverse dose ratio. In other words, the more you exercise, the less death you have, the less cardiovascular death you have, the less risk of cardiovascular disease you have. Next slide. And this is just a visual slide to show us. Limit that inactivity 2 to 3 times a week. Do some stretch-ups and push-ups. Try some sit and reach exercises. Do some mild weightlifting. And then the other 5 to 6 days a week, do something moderate. A brisk walk, cycle, row, swim. Dancing is great exercise. Skipping rope, football, badminton, basketball, tennis. And then every day, do your usual stuff. Go upstairs, don't take the elevator. Walk to shopping. Park a little farther from the grocery store. Park to the back of the lot, walk a few extra steps, a few hundred extra steps, etc. Next slide. We'll go into secondary prevention. What's the importance of exercise in people with known heart disease or cardiovascular disease? And we know that it does increase life expectancy. We know exercise tolerance and quality of life goes up because people can do more. They improve their cardiovascular lipid profile or cholesterol profile. Insulin is more active and glucose levels go down. And we know there's a slowing of progression of coronary artery disease or peripheral arterial disease, and improved function of the endothelial wall, which is the arterial wall. And then we reduce the resting heart rate, because we know heart rates above 80 to 100 all the time is not good for you. It shows an increased risk of death. Next slide. So in secondary prevention, I do recommend that you either have a stress test to see what your rate is, what you can do, or an exercise, an exercise prescription stress test, or going to cardiac rehab. And they will actually monitor you while you're doing exercise to see what you're capable of doing. And if you have chest pain, then we would know, is that really cardiac chest pain or is it muscular chest pain? And then we can individualize the exercise, because it's different for everybody that has coronary disease or cardiovascular disease. We know that in middle-aged men and women, there's a 30% reduction of death with aerobic exercise, but just starting it for 3 solid months. If you do 3 months, you reduce your death rate by 30%. That's incredible. And then aerobic exercise in low-risk individuals is very, very effective. And it's as effective as putting a stent in, improving your daily activity, improving blood flow to the heart, to the brain, and to the legs. And then we see less events of angina and less death. Next slide. 30 to 60 minutes of moderate exercise as brisk walking is really important. And that's even walking during breaks or gardening or housework, and then trying resistance training twice a week. And as I noted in that earlier study, that people with known peripheral arterial disease, in other words, they had pain when they walked, would start doing some weights, and they actually showed improvement of blood flow and less symptoms. Next slide. So what counts as moderate activity? We kind of mentioned this: dancing, swimming, active recreation, soccer, cycling, gardening, hiking, walking. Get out there and move. And if you don't like the word exercise, use the word movement therapy. Just change the words a little bit. What's the ideal exercise program? You should warm up. You should do some endurance training. You should do some flexibility, some strength and resistance, and then a cool down. If time constrains you, you have 30 minutes a day, then do the resistance training only 2 to 3 days a week. The rest should be aerobic exercise. And consider, if you're in good shape, high intensity interval trainings. Warm-up should be 5 or 10 minutes, and then you should have about a 5-minute cool down after. You shouldn't just stop and sit. That's not good for you. Next slide. Endurance training, we talked about what we could do. It includes dynamic exercise that moves, and you should do it, again, 30 minutes. And then if you're getting technical, you want to do about 46% of your maximum intensity is what we call moderate, right? And then about 80% is the more progressive intensity. And this will be determined by your age, because obviously a 90-year-old cannot do what a 20-year-old can do. At 60, I cannot do what I did at 30. And it's physical ability, even though I kind of impress people at 60 what I can do. And then perceived exertion scale is very important, especially people that are on beta blockers. The scale we use goes from 10 to 20, and you should be somewhere in the middle. You kind of feel like you're really pushing yourself. And that's a perceived exertion scale. Next slide. Flexibility is important. It improves your range of motion. It increases blood flow, decreases injuries, and especially for lower back and posterior thighs, it really reduces back pain. Most of the back pain is not disc disease. It's tight hamstrings, tight glutes, tight lower back muscles. Next slide. And resistance training, you know, you're going to use a low, moderate resistance, low amount of weights in healthy adults, and they should be screened for this and use a trainer if they can. And you want to do about 8 to 10 different exercises and using those big muscle groups, and do that about twice a week. You want to do about 8 to 12 repetitions. You don't need that 3 strength max. And you want to, in cardiac patients, maybe a little higher, 10 to 15 repetitions. And maybe those that are older than 60, about 10 to 15 repetitions. What's interesting is there was a new publication that came out, and Give Me 40. To assess what your overall health is, try to do 40 push-ups. If you can't, as a 30-year-old, then maybe you're not in good shape. We know if you can do 40 push-ups, heart risk by about 90%. Next slide. Last thought. I like Dr. Fletcher at Mayo Clinic here in Jacksonville. He says, just take medication. The right form of physical activity has to be specialized for each patient. Inactivity has elevated cardiovascular risk, along with smoking and bad diets, high cholesterol, inflammation, blood obesity, and high blood sugars. Cardiovascular is preventable with exercise, along with other forms of risk reduction. And it can reduce disability, can reduce death, prolong survivability and quality. Exercise has a positive effect done immediately. Even if it's transient, you can do it this week and not do it again. There is an improvement. And then symptoms actually are reduced markedly with 50 to 60 minutes of vigorous exercise a day. Next slide. So where are you on the health scale? Thank you. I appreciate the opportunity to speak.
Thank you so much, Dr. Lopez, and thank you for working through the technical difficulties we seem to be having today. I would like to now turn the table over to Tiffany Hackett-Stuart, who is going to talk about the patient perspective on exercise. Tiffany, are you there?
I'm here. Can you hear me?
Yes.
All right, perfect. Thank you so much, Dr. Lopez and Andrea. So I was really excited when this topic came up because I'm a patient, I'm a nurse, and actually before I went to nursing school, I got my degree in exercise physiology. That's my first bachelor's degree. So I did a lot of research for this with exercise. I really focused on exercise psychology, so I'll definitely talk about that as I go through my slides. So you can go ahead and go to the first slide. Thanks. So really tagging on to everything Dr. Lopez said, he really highlighted some really important things, and really what I'm going to say, I'm just going to maybe give a little different perspective, but exercise is so beneficial with helping prevent heart disease before and after a diagnosis, and it's just something that I really wish people, if we just moved a little more, I think just the way our lifestyles have become, I've seen so many amazing things, whether it's my own being a patient or taking care of patients, that just some little changes in just moving your body. And I think kind of like Dr. Lopez says, you don't have to call it exercise. I'll even say I'm just going to move my body more today. And I think that it just sounds more fun. I don't know if that's the word, or less prescriptive. But really physical activity really does contribute to, you know, earlier cardiovascular disease, obesity, type 2 diabetes, and earlier death. And increasing your physical activity can also help with anxiety and depression, and I definitely did a lot of that. So this slide is perfect. So when I did my first undergrad study, we really looked at cardiac activity and depression. And then I did a study with resistance training and anxiety. And it was amazing. These are lifelong skills. I have teenage kids who, my one daughter is very high strung, or I've worked with patients, and just kind of like learning just to move your body. Like I said, I've seen huge changes. And again, after a cardiac event, the risk of depression and anxiety goes up significantly. So not only can tying in that exercise help with just the emotional part of that event, but again, that rehab part and getting you back on track. Next slide. So kind of as we said, Dr. Lopez said, even low levels activity can help reduce the risk of additional heart events or even prevent heart events. The saying of getting some exercise is better than none at all. And again, if you've been inactive, I don't think anyone expects you to go from the couch potato to running a marathon in 3 months. You got to start slow and try not to feel overwhelmed. You know, don't want to take on that huge chunk, because then you're going to get discouraged and you're going to go back to the inactivity. Next slide. So build it into your day. And there was that great pyramid. I love that example. It was a very good visual. You know, exercise doesn't have to be complicated. It doesn't have to be, you have to have that, you know, gym membership or attend the class at the gym or work out with a trainer. There are so many options now. It can be your daily cleaning. You can be what fits best for you. I like and I've worked with patients about, so 30 minutes a day is the recommendation, but break it up into 10-minute, 3 10-minute chunks. I have to do this a lot of the time, especially on the days I'm working at the hospital and my kids. So maybe I try and do 10 minutes in the morning, 10 minutes at some point at the hospital, and then another 10 minutes at night if that's just going for another walk. Or now you can do so many different videos, you know, through YouTube and online. Or if you're doing those house chores, maybe turn on the music and dance while you're doing it, or be a little more vigorous in that vacuuming or that dusting. Same thing, stand up when you're talking on the phone. My husband paces when he's on the phone, which actually, in preparing for this, I was like, that's actually a good thing. It does sometimes make me a little crazy, but stand up when you're on the phone, or if you're on a conference call, if you have a job where you can have like maybe a sit-stand desk. Or I've even seen, like, when I worked more in an office situation, people had the pedals under their desk. So it's just getting creative. Or resistance bands. I used to always have one on the back of my work chair, and so I'd be on a conference call and I'd be doing different resistance band exercises. So really, it's just tying it into something. It doesn't have to be this real structured thing, because I think that's discouraging. Next slide. So be consistent. I think this is the hard part. We get on a great routine. Like I've been going to the gym and I went for a run today, and then I've gotten it in like 3 to 5 times in the last few weeks, and then life happens. You know, whether it's you're traveling for work, you're traveling for fun, you've got that graduation, that anniversary, that wedding. It's just being consistent and not being hard on yourself. You know, keep it up while you're at work, kind of like Dr. Lopez talked about, and something I perfectly do. I park further away, or maybe I take the stairs if I need to go up to another floor at the hospital. Instead of getting on the elevator, I just take the stairs up and down. I work at a very large facility, so I can definitely get a lot of walking in, just going to different departments, or if I have to go to a different meeting. So a lot of people have that. Or, you know, walking to your mailbox if it's not in front of your house, instead of just stopping on your way home and getting out of your car and doing that. Or walking the dogs, or whether it's walking with children or grandchildren, going to the park to play. There's just so many things you can really incorporate it into your life. And I think set realistic goals. Again, if you set these giant goals, or that just aren't realistic, or SMART goals is the term people like to use, you're going to be easily defeated and give up. And so I think that's always my thing is, you know, not every day is going to be perfect, but just try and be as consistent as you can. Next slide. And always consult your physician, of course. Some physicians may recommend how much and what type of exercise is best for you. Cardiac rehabs, I think, is a fabulous program. Again, You can be safely monitored. Again, if you've had some kind of a heart attack or you recently had heart surgery, you definitely want to be in cardiac rehab. Plus, it gives you that extra little boost of confidence that you have someone there watching you. It's going to be safe, and you can build your confidence to being able to go do things on your own and learn a lot of what works for you and what you enjoy. Because at cardiac rehab, they get creative. A lot of people are exercise physiologists, and they're passionate about what they do, and they really learn to, it's individualized. What works for me is not going to work for Dr. Lopez, is not going to work for Andrea. Again, combination of strength training and cardio. And then just the gym and being at home, you can kind of come up with your own thing. It doesn't have to be expensive. It can be the resistance bands. It can be, just doing some squats every commercial, whatever it may be for you.
Great.
Right. Thank you so much.
Thank you so much, Tiffany. That was great. I want to also thank everybody for being here today. And now we are going to go into our question and answer period of the webinar. Before I start the questions, I want to remind everybody that our next webinar in the series is on June 6th, and it is controlling risk factors for women, and it will be at 12 o'clock as well on the Eastern Coast. We have two ways that you can interact with us and ask questions. One is to place the chat, write your question into the chat box, which is on the right-hand side, and then I can read that to the panelists. Or we can also, if you raise your hand, which is there's a little hand button beside your name. If you click that, it will alert me that you have your hand raised and you would like to ask a question. So then I can unmute you and you can ask your question. We already have a bunch of questions in queue, so I will just go ahead and get right to it. The first question is for the doctor. Says, I suffer from chronic pain in my spine and shoulders, as well as some balance issues, which makes exercising difficult and it discourages me from trying. I've been through physical therapy series twice, but the pain limits what I can do. Any suggestions would be welcome. I'm 75 years old and a son of 2 athletes and used to be quite active myself.
So yes, this is not uncommon, and I would recommend, if you have access to a pool, this would be a great way to start. And you don't have to do the regular stroke. You can just even doggy paddle. There are fins that call TYR tire fins, which keep your lower body elevated so you don't sink so much. But you can even get into the short end of the pool and even walk through the pool. And those can be done. There are some physical therapy places that do have aqua aerobics, and some have limited pools that you can walk through, and which allows to put kind of a wave through it that gives you some resistance. But pool would be one of the best ways for you to do. The other one would be a seated bike or a recumbent bike. Tiffany, do you have any suggestions?
No, I think the pool is a great suggestion. I've always definitely recommended that as well, just because, again, or if you're coming off an injury, you don't have all that pressure on your joints, but you can keep moving. And like you said, just even walking laps in the pool, I've done that, and you're like, oh, wow, this is quite a good workout. And it doesn't have all that pressure on you. And it actually kind of feels a little good because it does. You don't have that gravity in there. So it'll help your back probably feel a little better.
The other thought is immediately, several hours later, even afterwards, make sure you stretch afterwards. Consider a mild massage, just, a mild rub down to get blood flow back into the muscle and the joints, and that would help as well.
Great. That's great suggestions. I love the pool idea. Yeah. So the next question is it safe for a heart patient to train hard, as in for a half marathon?
Again, I'd go back to the stress test and get an exercise prescription. I have seen patients after open heart surgery or heart attack go back into full exercise, but I would definitely get assessed first by a cardiologist or a good internist or an exercise physiologist or a team, even better, and then increase training incrementally from there. Is it possible? Yes, but be safe when you do it. Get checked.
Great, thank you. Can you re-answer the question of what is a MET? I think that it needs to be a little more clearly identified.
Tiffany, you want to do that, or do you want me to do it?
I'll let you do that, but I definitely felt a reminder of my undergrad studies.
So MET is kind of a rate of energy expenditure during exercise. And it's a base MET is a calculation of 3.5 milliliters of oxygen per kilogram of body weight per minute. So it's measured, one MET is measured at rest. So it's a calculation that exercise physiologists would use or physicians would use in a lab setting. And as they're driving the treadmill, we know that if we put that up 5 degrees and go so far and you're kind of like moving faster, you push your METs higher. So we'll look at it that way. So a 5 to 6 MET is kind of that moderate activity, okay? 5 to 8 MET, over 8 METs is your really intense activity. And that's kind of a base look at it.
Great, thank you. I have heard there are heart attacks in cold weather, more heart attacks in cold weather. Is it safe to do physical stuff like snow shoveling if you're a heart patient?
And I think that all depends on your exercise potential. You really think of the action of shoveling. It takes multiple muscle groups, it takes strength, and it takes aerobic. And can you do it? Yes. Probably better with machine. But again, I would talk to your doc about that first and get yourself into cardiac rehab. I have had heart patients that shovel. I did my training in Philly at UPenn, and it's not uncommon to see that. And it's more people that are deconditioned and not exercise tolerant. But you can build yourself up to doing shoveling, absolutely. You just have to do it at a more moderate or slower pace.
Excellent, thank you. Would you consider yoga a part of moderate exercise or activity?
If you asked me that 40 years ago, I would have questioned it. Until I did power yoga, it put me in the floor. I do like yoga. It has stretching, it has some strength to it, it has core training. It is more isometric, but you can add some resistance to it as you use your body to raise yourself, and it's done very controlled. Yes, it's good exercise.
And I'll tag on to that too. I would completely agree. And there's such a variety of yoga or even Pilates as well. You kind of, I think if you see them, you're like, oh, you're just stretching. It's not that big. But I can definitely do a yoga workout and be stretched and sweat and feel like I had a better workout than had I gotten on the treadmill at the gym. So I definitely think, and again, it's just go at what's comfortable for you and what your state's doing.
Men, don't think you can't do yoga. There are classes of broga. You can do it too.
Excellent. So after a heart attack, do the capillaries around the damaged heart improve with exercise?
Yes. That we call that two things. That's physiologic revascularization. That's our technical term. Basically, you get the smaller blood vessels come around and dilate again. And then you push that vessel that's been damaged to kind of, as you exercise, you decrease the inflammation in there. Nitric oxide goes up, and then that muscle kind of revitalizes itself. Yes, it does.
Great. So what are some examples of good resistance exercises for people with bad joints?
You can start with simple things as a band, and the thickness of the band and how tight you make that band increases the amount of resistance you have against it, the weight you're pushing against it. But you can start with easily, 1, 2, 3, 4 pounds. I usually tell people start with 5% of their body weight or less, and then work their way up. But that's shown benefit. You can do it in a gym in a controlled setting with weights. You can do it with bands. You can do it with body. You can do it with cans. You can do it with, a pint bottle and add water or sand to it and add weight to it that way. But safe weight I would start with is just body weight and maybe a 1 pound weight, and then move from there.
Great. Did you have any suggestions, Tiffany?
Yeah, no, I think the bands, I'm a huge fan of bands. They're easy to travel with. They're easy to, shove in a bag, keep in a car, take in a suitcase. And typically when you buy them, Amazon's my favorite place to shop. They come with multiple resistances in one package, and they come like in a little nice container. I also totally reminded me of doing a project when I was getting my undergrad where we had lower socioeconomic groups, and we were using the cans of food for resistance training, really your own body weight. It's amazing what you can do with your own body weight as well. But yeah, bands, using cans of food, using actual weights, which you can pretty much buy anywhere, or again, at a gym, at a facility. Those are kind of all really, I'm just a big fan of bands, I think, just because you can do so much with them in pretty much any location.
Yeah, slow and low is the way to go. That's how you start. Low.
Great, thank you. And the next question is my favorite because it directly applies to me with my struggles at home. I'm thinking about prevention. Do you have any suggestions for getting kids to be more physically active?
Tiff, do you want to answer this first and then I'll add?
Yeah, no, I'll take this one first. So I think it's really, you lead by example. Kids really do mimic. I have two children. I have a 16 and 12-year-old. We spent a lot of time playing at the park when they were little, running around, or even when they were little, they liked to do, if I tried to work out at home because it was harder to go somewhere with them, they liked to do yoga with mom or try and do the workout video with mom. Doing family walks, it doesn't have to be a huge thing. Swimming in the pool as a family, depending on what your weather is and where you live, or if you live in a cold climate, I'm sure there's, whether it's skiing or ice skating or plenty of outdoor activities. I'm in Arizona, so we don't have very much cold activities. But as a family, we go hiking every Sunday morning. That's one of the things we do. And we get breakfast and eat it at the bottom of the mountain, and then we hike together. So I really think making it a family thing and leading by example is really the best way. Riding bikes. I'm just trying to think of all the different things we do with our family, and my kids are really active, busy kids. They've just kind of always stayed that way.
Yeah, I agree. I think if you set by example, they'll do it. It was an interesting study done probably about 10 years ago, and they questioned the survey on college students. Why are you going to the gym? Because you look better, or you look tighter, do you feel better? And the most common answer was, well, my parents exercise, so we did it with them, and so we continue to do it afterwards. And so if you set by example, they'll do it. But make it fun.
Great, thank you. Yes. The next question is, does a stent pose any special problems for exercising?
No, again, there's a period of time where cardiologists will not want you to do a lot. He will tell you to start moving and just walking, and then you'll build your tolerance up again. But that's a great conversation to have with your cardiologist at the time. But no, it does not. There's no real restrictions. Eventually, it's just starting slow and getting your recommendations from the cardiologist.
Great. Do you recommend Fitbits or Apple Watches, etc.?
Tiffany, you want to answer this?
I love my Apple Watch. I'm a very competitive person, so sometimes I'm almost like, dang it, you just have one of those days where you didn't quite you get all your circles filled or get all your steps in. So sometimes it can be negative to me, but I really do like it because it gives me an idea of more so with the steps, or you can kind of set your own goals. So my move activity, which is where you're more doing a cardiovascular activity, is 30 minutes today or 40 minutes, whatever you set it for. And I'm a very visual person. So seeing those rings move or seeing how many steps I've had. And then again, is it like mid-afternoon, I'm like, oh, I should probably make sure either if I'm at work that I kind of just find ways to do things at work, or when I get home, I definitely, take the dog for a walk or go for a bike ride with the kids because I probably won't be able to get into the gym today. So I really like it as it keeps me on track, and it's just that good visual reminder, and it'll, kind of clue at you. And again, it has the stand-up reminder. So it wants you to stand up every hour, and it will remind you and tell you how many times or how much during the day you have actually been standing up, which I think is a really important thing as well. So for those who like that visual, reminder or those extra little cues and clues to keep moving or to stand up, it's very helpful.
You know, the other point, and I think you know this, Tiffany, is, you know, we've seen now with these Fitbits and watches that you can actually even check your rhythm. And if your rate is excessively high and stays up, it will alert you to alert your physician that something's going on. And I've had that with a young woman who's 30 years old and said, you know, I had this really fast heart rate and I was sweating diffusely and she looks great. And I couldn't figure it out. She downloaded her watch. I put her on a heart monitor and she had supraventricular tachycardia at a rate of 160. So she was right. She caught it. She caught it with her watch.
And I have a friend who is 40 and same thing. She was getting alerts on it and did a Holter monitor and they found same thing. She was having long runs of PVC. So the technology is getting impressive. Yeah.
We as physicians have to learn to adapt with it, and not all of us are, and that's unfortunate.
Yeah, that's great. I love my Fitbit. So, does exercising help remove plaque from arteries?
That's controversial. I will tell you, yeah. In real life health, we've used a mixture of supplements, prescription medications, exercise, eating lifestyle, and changing the exercise intensity. And we've seen reversal of plaque on coronary and tunnel thickness exams. Dean Ornish and Carl Esselstyn at Cleveland Clinic have shown reversal of plaque with plant-based diets. But the combination does better. How you eat, how you move makes a big difference and can reverse plaque, yes.
Excellent. All right, the next question is, if I have heart disease, should my children be tested for heart problems before joining a soccer or other sports teams?
Age dependent. We know that atherosclerosis starts early, and it's probably happening earlier now that our kids no longer have active exercise in school. But we know that when we looked at Vietnam and we did autopsies on our young men, we noted atherosclerosis in their arteries at 17 years old, which means it's probably developing pre-puberty or at puberty. So the question is, do they need to be screened? Probably not, because they have wide open highways of vasculature. But if they're more mature in their 20s or 30s, should they? Yes. And in fact, today we're seeing younger adults have more cardiovascular events and heart attacks because they are inactive. But again, if you put them in soccer, start walking around the block with them. Walk, or you jog and they ride their bikes. Get them ready for that exercise. But as a young child, probably not. Unless you have familial heart disease or a congenital abnormality, or the doctor said I hear a murmur, that's probably the exception to the rule.
Great, thank you. And I have one last question. If anybody else has any questions, please feel free to send them in. I will check for hands that are raised, but somebody wants to know if either of the speakers use a standing desk.
I'm moving so much, I don't. So moving in and out of patient rooms, I don't. I'm recovering from pedestrian versus auto. And so I'm finally moving again, and I feel great that I'm moving better. But I make it a point to try to move all the time, even if it's just a walk or in a pool. And after the accident, I doggy paddled. Can I go back to the previous question? Should children be screened? And I think both you, Andrew, and Tiffany should put some input. Your children should be screened by their pediatrician in a pre-physical, because that's important, because you find certain things, whether it's hypertrophic cardiomyopathy, a thickened heart, or you hear an abnormal murmur, or children don't feel well when they exercise. Those are important tags. Could you guys talk a little bit about kind of screenings and how it affected your guys' lives?
Yeah, absolutely. So I just turned 42 weeks ago, so there was no ultrasound. My dad was military. I was born overseas. So I was diagnosed post-delivery. But I know now being involved in the congenital heart world and being a mom of 2 children who, thank goodness, don't have congenital heart disease, but my children were watched a lot more closely. Also, my one daughter does have a murmur, and so she's had multiple workups. I thought something that was very interesting I learned probably last summer was that even though she had a workup when she was first born and within that first year, they still felt that both my kids needed a workup again last summer to be officially cleared of not having congenital heart disease. So they may not trigger those initial things. Like, it's so important to do that 1 to 2 day follow-up at the pediatrician's office, because you may catch an undiagnosed CHD or anomaly, but really having a pediatrician who's checking the blood pressure when they go in, not just, I think a lot of times that gets missed. Oh, they're kids, they don't have high blood pressure. A doctor who's thoroughly looking at them. And if anything does come up, to do those EKGs, because I think kids are so tricky. You hear about these sudden deaths on the soccer field, and they had an arrhythmia the whole time, or they had some kind of undiagnosed congenital heart disease. I do know here in Arizona, if your child is going to participate in sports, there are organizations who will go do those screening EKGs for free. It's actually a mom who lost a child in college athletics, and she has a cardiologist read those. So I think there's things like that, is a thorough sports physical versus you just go, they do your height and weight, can you touch your toes, looks good. I think a true sports physical is important for kids.
Yeah. And I'm glad you mentioned that, because after I thought about it, I wanted to come back because my answer wasn't totally fair. Every kid should have a pre-sports physical, and it should be done by a pediatrician or whatever, family practice, like someone, or a nurse practitioner or a PA, someone that really can examine them and understands the proper way to do a good sports physical. And yes, they should always have it. So I meant my original answer.
Thank you. And I agree. I think that if there's any history in the family of congenital heart disease, arrhythmia disorders, or anything like that, I think that children should be screened, before joining the sports teams. But I don't believe that has a lot, unless it's a genetic and it's hereditary, it may not have a lot of reliance on the parent's heart disease. But I think that you're right, Tiffany. It needs to be a thorough sports physical, and not just, my son gets one for Boy Scouts every year, and he goes in, not my son with congenital heart disease, but the other one, and he'll go in and they basically just sign the paper. So, I do think that a good workup is always good. And we have great pediatricians, though, that follow our kids. And my daughter had a murmur, and we followed that. But I think it depends upon the family and depends upon your, history and the family tree, but it can't ever hurt, for sure. The last question, I was going to unmute her, but it looks like she typed the question in. It says, just wondered how to treat a fast 160 plus heart rate found on an iWatch. So I guess it would be, is that a concerning problem? What would you do if you found that?
Is that with exercise or that at rest?
I don't know. I'm going to unmute the person who asked the question. P. Johnson, you are unmuted. Would you like to answer that question? Are you there?
It could be either.
So if it's happening, heart rate's that high, I think is beyond dehydration. You probably should get a good exam and an EKG, and probably a stress test, maybe an echo. But it would be important to get screened for that. Heart rate of 160 after exercise or in high intensity exercise is not abnormal. But as you exercise, the rate goes down and you get adaptive, right? You get that adaptive reaction to it after a while. At rest, that's not normal. You should really have that checked.
Great, thank you. Well, I believe that we have answered all of our questions today, and we are a little bit over time, but thank you all for your patience through all of our little technical difficulties today. I think the conversation was great, and I would like to take this time to thank our sponsor, Amgen Cardiovascular, for providing us this educational grant to bring these webinars to you. And I would also like to thank Dr. Lopez and Tiffany Stewart for joining us today. Lots of really great information that is, I think, going to be very useful to a lot of people. So thank you all, and have a great day.
Thank you. So much fun. Thank you.
Thank you.
Thank you.